Hello everyone. This short video is an explanation for the spread of COVID-19. It's based on publicly available data and a simple exponential model of the spread of the virus. The moral of all of this in the end is that we need more testing, and I'll try to explain that as we go on. So where do we start? Let's start in December 2019 in a small community with about 200 residents, let's say. At this moment, no one has been exposed to the disease. The disease is not present in this area. This community, the data that I'm using really mirrors the dates when things happened in Italy. But the spread is similar everywhere. The rates might be a little bit different in some places, but the general idea is going to be the same. Okay, so December 2019, everybody is yellow, everybody is susceptible, nobody is yet infected. Then on January 31st, 2020, for us, that is day zero. That corresponds to the very first time that, as far as is known, the virus was introduced to Italy, let's say in this little community. And the virus, the infected people are in yellow, in pink in this video. The infected person may have picked it up traveling. I believe that in the case of Italy, the person did come from China, but they may have picked it up from going to work and picked it up in the next town over where they work, or in various other ways. But this is the first time the virus is introduced in the community. This infected person, I should emphasize, is not yet sick. This person does not know that they have the virus. And nobody else has it, and nobody else knows anything about it. This community would still say that the virus isn't here. But if we go forward, it turns out that if we're going to go forward to day 5, which is February 5th, this virus seems to be spreading at a rate where the number of infected people triples every 4 or 5 days. So for the purpose of this video, we're going to use the 5 as the magic number. And in 5 days, we've gone from 1 person infected in this little community to 3 people infected. And I should emphasize again that, for the first time, that you can think of these dots as representing where people live, but they travel around. And so this first person who was infected, I think it was this one, and this new person infected may have met somewhere else as they travel around during the day. And so the fact that they travel around is why they are infected. Not everybody who this first individual met in the 5 days got infected, but based on the data, it would seem that after 5 days, we have about 3 infections, which still doesn't seem to be a lot, and nobody is yet sick, and nobody would really know anything about it. If we go forward to day 10, we've gone now to 9 people infected, and most importantly, perhaps, we have the first person who is sick. Now, they may not be very sick, and they may not realize that they have COVID-19. They may think that they just have a common cold or something else, or maybe they think that they always have a cough this time of year. So whether or not this person realizes why they're feeling sick, this individual gets to be the first person in the neighborhood, in the community, to actually show symptoms. But notice that we are already up to 9 total people infected in the community. If I've counted correctly, there are now 9 yellow dots, and we are 10 days in. Okay, and I should point out, maybe I said this earlier, but there are about 200 dots altogether on this screen, 200 total. So we go forward to day 15. The number of people who are ill has tripled. There are now 3 people who have the disease, and there are now 27 yellow, pink and red dots, about 27. It again tripled in those 5 days. So we are at 3 to the third, 27 infections. And one of these 3 people is probably beginning to feel more than just a little bit sick. Somebody's feeling really bad, but they may still only begin to suspect that they have the virus. They may not be clear. Now, one of the people who got sick in this simulation is the person who came, who first brought the disease into the community, and so that person may suspect that they were exposed to it where they were before. So the community may feel like it has its first case. Maybe a couple of people may realize it, but on the whole, the community still doesn't realize how bad things are. Most of the people who are infected show no symptoms. Okay, we go forward again. This is now day 20, and now things are beginning to look pretty bad. We have tripled again the number of infections. Not quite. The size of the community is beginning to limit the number of infections, so we don't really get quite up to 81, but there are a lot more yellow dots, a lot more pink dots on the screen, and we have tripled the number of people who have the disease. Actually, there's 1 less, so I guess there are 8 red dots, and a couple of these red dots are very sick, and probably somebody has been hospitalized, and probably somebody, the community probably is becoming alarmed. They're beginning to realize that something really bad is happening here, but they don't yet realize how bad. When we go forward 5 more days to day 25, we begin seeing even more spread. More than half of the community is now exposed. A number of them are now sick. About 27 have gotten sick. And now we have the first death in the community. The first person has died. And of course, everybody is getting pretty alarmed. But it's also true that we have the first green. The first person who's had the disease and recovered. And so if someone has gotten the disease and gotten over it, gotten the infection, I should say, and gotten over it, they go to green. They have, at least for a while, immunity from the disease, and they won't be getting it again in the short term. But of course, the bad news is in black, we do have 1 person who's died. Let's go forward again one more time. This is now day 30. This is March 1st. In this little community, in this simulation, we have the second death due to COVID-19. And since there were 200 dots, that's 1% of the population has now died. That's actually a lot. And in one way of looking at it, it's 2 people. But in 200, 2 people is 1% of the population. That's a very large death rate in a very short period of time. The number of pinks now actually outnumbers the number of yellows, I believe. Certainly pinks, reds, and greens. And the only perhaps little bit of good news is that we now have several more greens than we had before. The numbers in Italy indicate that for every death we get about 2 recoveries. And so that's also depicted here. In fact, we've had 2 deaths, and in this simulation, 5 recoveries. Okay, but notice there are several other things going on here that need to be discussed, and this gets at the theme that I mentioned at the beginning, the need for testing. Notice that there is this 1 pink dot that I've actually put a blue ring around, blue circle around. That's because that person was infected on day 5. If you go back to the very beginning, that person went pink on it was not the first person. That the first death was also the first person infected. But one of the second two people infected, that person has never gotten sick, even though they've been carrying the virus for something like 25 or more days. And this seems to be one of the things that we see with this virus, that there are people who get the virus, get infected, but then do not get sick for a very long time, maybe never. And that's one of the real challenges that we need to consider with this virus. Because if there are people who get the virus and begin carrying it and spreading it, but never get sick, their bodies may not see it as a threat, and they may never build up any immunity to it, so they would be perpetually carrying the virus. This is not something that we normally see a lot, but this is similar to the rather famous case of Typhoid Mary, who was probably accurately attributed to the spread of typhoid and the deaths of, I don't remember how many people, even though she never got sick and showed no signs of typhoid, and even though she did everything she could to avoid spreading typhoid, she was a perpetual spreader. And this person might be a perpetual spreader of COVID-19. This is why a test for the virus and being able to test essentially everybody, or at least everybody in an area known to have any cases, is so important. These people who might be carrying the disease without ever getting sick, if we aren't able to test them, and maybe test them several times, we may not know their situation because they're just not getting sick. But there's something else that we need to be aware of, and that is there's an alternate view of day 30. If we change things a little, this alternate view comes into play. And the difference, if you notice, between the initial view on day 30 and the alternate view is that a bunch of pink circles have gone to green. And in this alternate view, we have a lot more people who are recovering from the virus. And by going from pink to green, that meant they went from infected straight to recovered without ever getting sick. They never knew they had the virus, probably, unless they just happened to be tested. And we have not been doing a lot of tests, and neither did Italy in mid-February. So there could well be a bunch of people out in the community, in the U.S. and in other places, who were infected with the virus and now have recovered from the infection, but they never got sick, so they don't even know they ever had the virus. They think they're still susceptible. In fact, at least for a while, they're immune. This is extremely important because these immune people, these green circles, lead to the herd immunity that has been discussed. If we got most of the circles to be green, if we get into that state, then the virus is not going to spread very much anymore because there are just too many people out there immune to cause the epidemic level spread that we've been seeing. This leads to the need for a second kind of test. We need to have a test for antibodies. This test has been discussed and is being developed in England and in Germany, I think, and in South Korea, based on what I've heard. It has not been widely discussed in the United States, but this test doesn't tell us whether or not somebody has the virus. It tells us whether or not somebody ever had the virus. It tells us if they have the antibodies in their system that fight off the virus. And if they have those antibodies, they're not going to get it. They've already had it, at least they were already infected. And knowing whether or not we have this situation with few people recovered, or this situation with a number more people recovered, and maybe even more than what I've indicated here. There's no data to say what this parameter is. We have no idea. We are flying blind until we know this sort of information. So the upshot of all this is that we desperately need many more tests for the virus and many more tests for the antibodies to the virus. If we were able to widely test everybody, we could really do a lot to pin down where this virus is, and particularly if we found that many, many more people were testing positive for the antibodies and negative for the virus, we would know that we were much farther along in this pandemic than anybody now guesses, and it would be safe to begin opening up again. So this is a hugely important bit of information, and we just don't have the data right now. We desperately need those tests. Okay, the other thing that I wanted to discuss in this video was what I'll call physical distancing, and you may have heard social distancing. That's fine, but I prefer physical distancing because it's the physical distance that really needs to be maintained. Let's go back to day 15. This is day 15. This is the same screen you saw before for day 15, and indeed this is February 15th in our little simulation. Let's suppose that at this stage a very strict physical distancing scenario was implemented, maybe even stricter than what we have now, and maybe stricter than what has been in Italy for a while. We would put up basically barriers around groups of people who live together or in close proximity, and we would certainly also isolate people who are sick so that they don't spread the virus. Now, we don't know who's pink and who's yellow. We're just putting up barriers around families, around small communities. Sometimes even there are individuals who live alone. They may not have the virus, but we're going to keep them to themselves. And in this picture, in this simulation, we're actually assuming that they don't even go out for groceries. They stay at home or without getting within 6 feet of anybody outside their little group at any time. That is the most strict form of physical distancing. But the upshot of that kind of physical distancing is that we still, and notice I've gone back down to February 25th. This is 10 days later. We still have somebody who's died, somebody who got sick and who died. And again, it's the very first person who was positive, infected with COVID-19. But we have lots of these groups that nobody is getting infected in this group because they're completely cut off. Of course, they're also not becoming immune, but this kind of process can be used and is now being used to force the virus into the open. More people are getting sick, but we know where they are, and we can begin cutting them off. So maybe this person we would isolate. This person we would try to isolate. Same thing here. And if we quickly isolate people that are sick with the virus, and maybe we also are able to test people, and we begin realizing who's infected and who's still susceptible, and we can cut those off from each other. As we can do more of that, we can keep the virus from spreading, and we won't achieve the immunity that we do if people are widely going to green. But what we will do is keep the number of deaths down. We will avoid flooding the system, the medical system, with very sick patients, and perhaps causing a collapse of the medical system, which is the biggest concern. Okay, again, my takeaway message from all this that I think that I really feel like can't be emphasized nearly enough is that we need more testing. The faster we can test, both for the virus and for antibodies against the virus, the faster we know who's infected, who's not infected, who's been infected but is no longer susceptible, the faster we can get out of all of this. Okay, that's the video. Hope this is helpful.